Okay, colleagues, I'm sorry about that. We had thought we'd got the technology sorted, and then for one reason or another, it didn't transpire as we would have hoped. So we've now resorted to using individual laptops inside this room with some colleagues in their respective offices. What we will do is we will need to close off each of our speakers as someone else speaks. So we'll pick that up as we go through the process. So first of all, welcome everybody. Thank you for joining. Cooler where you are than it is where we are. Board meeting. Did all members receive papers in good time? For people to confirm, it's great. You can nod. Don't worry about putting your microphones on. Comprehensive. Yep, great. And is there anything that members feel are omitted? Papers that we might need to discuss as well. No, okay, I'm presuming not. Great, and then as ever, the kind of decision-making principles that underpin the way we make decisions at the board, it's useful to just reiterate those. First of all, foremost, that our decisions are fair, they're affordable and sustainable when we make them about the provision of services. They're consistent with our strategy and aligned with our direction of travel. They don't create an unhelpful precedent, and by that I mean because we make a decision here, it has consequence for other decisions that we might not want to make elsewhere. And fundamentally, the decisions we make lead to safe services. Great, okay. Having confirmed that and reminded everybody of that, what I'd like to do is first of all deal with apologies. So we have Eleanor Marks has apologised. Andrew Carruthers can't be with us today. I think Keith, if I'm not mistaken, you're online. Yep, Keith's joined us. Keith Jones has joined us, the Director of Operational Planning and Performance. Sharon Daniels, also Executive Director of Nursing, Quality and Patient Experience. Sharon can't be here. And I think Kathy Steele has joined us for this meeting. Kathy's the Interim Assistant Director of Nursing Assurance and Safeguarding. You're welcome to join the meeting today. Ardiana is unable to join us, Executive Director of Public Health. And I think Bethan's joined us. Bethan Lewis, nice to see you, Bethan, Assistant Director of Public Health, Strategic Business and Operations. Also, I think Chantal Patel has not been able to join us today. I think you'll pick up that part of the business where we look at some of Chantal's responsibilities as chair. Great, okay. And then I'd like to welcome David Williams, Audit Wales, to the meeting. David, you're very welcome to join us. I suspect it's hotter where you are than it is where we are, but you look as if you're in an air-conditioned room. Actually, you look like you're wearing a pullover, which is profoundly at odds with what we're all experiencing. Great, okay. Can we do any declarations of interest? So are there any declarations of interest relating to any of the items that we will cover off in today's meeting? No? Great, okay. Let us move then to committee annual reports. Joe, I'm going to hand over to you.
Thank you, Chair.
Yes.
So the purpose of this. No, it's okay. It's okay.
To do off of one point, we'll stop.
Is that any better? That be better? Yeah. So thank you, Chair. Apologies for the technical difficulties that we're facing this afternoon. The purpose of the report is to present to the committee the annual reports of all of our subcommittees of the board, and this is a requirement of our standing orders. Each annual report summarises the activities of the committees during 25-26. It sets out how they've met their terms of reference and also identifies key areas of work intended to provide assurance to the board. I'd like to thank our committee chairs for their continued support to the governance team and the hard work in leading each of their committees over the past 12 months, and also to each of the committee members, as you can see from each of those reports, the significant amount of work that these committees do on behalf of the board. So I will hand over to each of the committee chairs to present their reports. But I just want to apologise first before our audit chair presents his report, because as you can see within the pack, it's the draft report because we were waiting the head of internal audit opinion, which we've now received. So following the meeting, the revised report with the concluded head of internal audit opinion, which we received on Tuesday, will be included and circulated to members and updated on the website. But I'll hand over to Rodri to provide an update from the ALAC over the last 12 months. Thank you, Chair.
Okay, thank you, Joe, for that introduction, and I will take the report as read, and firstly just apologise because the report we've got in front of us here isn't the most up to date one, so that will be submitted as soon as possible. Yes, can I just firstly thank all the hard work from those within the committee, but also from, well, Joe and kind of the team, Charlotte, Claire and everybody, because there's been so much work, so much scrutiny. As you can see, the head of internal audit, the kind of overall opinion we've had this year is limited, which is disappointing. But after saying that, I think it was stressed in audit on Tuesday, regarding we are looking at areas, it's a risk-based approach, and we are looking at areas where we know there are issues. Therefore, I have to stress that it's it's a very honest report, and as I said, yeah, there's a lot of findings in there. There's a lot of good work happening within different areas of the health board. There's also areas where, as I said, where we've had limited assurance, and where we're looking back at those areas to ensure we are as the best we can be. Therefore, with those few words, I don't know if there are any questions, but I just want to reiterate the how grateful I am to everybody that's been involved in the work, and to internal audit itself for working hard with us in moving forward and progressing with the work. We've got a very packed programme of work moving forward for the next year. Therefore, with those few words, I'll pass it back to yourself, Chair.
Thank you, Chair. I think we're going to go through the reports one by one. So if I now hand over to Johan, who's the Chair of our Charitable Funds Committee, to present his annual report.
Okay, great. Prynawn da, good afternoon, everyone. It's a privilege to present the report.
On mute, sorry.
No, he's not. I can hear him fine.
Can you hear me now?
Yeah.
Yep. Okay, I'll try again. Prynawn da, good afternoon. It's a privilege to present the report this afternoon on charitable funds. I'll take the report as read. But firstly, we'd just like to thank all my fellow committee members for their input and support during the year and their scrutiny, and also particularly to Nicola Llewellyn and her team who oversee the charitable funds and the work which is undertaken alongside colleagues from finance, corporate and legal, amongst others, across the health board as well. You will see that during the last year, we've approved over £370,000 worth of funding through the Make a Difference Fund. And we have had, with additional scrutiny from committee members, now seen better evaluation of impact of our projects on people and our communities, both within hospital environments and externally as well. I would also like to commend the work of the subcommittee within charitable funds as well for the work that they do in terms of scrutinising and approving smaller projects which do make a significant impact across Hywel Dda as well. Just to confirm, in the past year, we've alerted the board to one particular funding application and issue, which was the Therapeutic Gardens at Prince Philip. We've advised on 2 issues, but all other projects and applications which we had during the year, we were happy to assure wider health board colleagues in terms of their robust and valid approach as well. Happy to take any questions, but that presents the overview for the Charitable Funds annual report. Diolch.
Diolch. So if we now hand over to Maynard to present the report from the Digital Data and Innovation Committee. Thank you, Maynard.
Diolch, Joe. Thank you, Chair. Very briefly, this was a brand new committee established April 2025, and it recognised the growing importance of digital as a transformation agency within healthcare. It's had a really good first year, and I think we've tried to drive forward the digital agenda in a constructive way that supports the activities of the health board. As others have already said, there's a lot of thanks to go around to the digital teams themselves for delivering so much in year, and to Joe and her team for looking after the committee and helping us get established so quickly. The report is as found, and I think we find ourselves at this time of year looking forward to the coming year, and you again seeing the growing importance of digital in helping us to transform our services and provide better services to the population of our health board. Thank you.
Diolch, Maynard. And if we now hand over to Anne Murphy, who's our Chair of Health and Safety Committee. Anne, are you happy to present your report?
Yeah, thank you very much. It reiterated my colleagues. I'm assuming everybody's read the report. From Rodri, I also would like to thank the support team that's given to the committees. Without them, we literally couldn't do our job as chairs. And for mine, our purpose is to provide assurance around the health board's arrangements for ensuring the health, safety, and welfare and security of all employees and those who may become affected by work release related activities, including patients, members of the public, volunteers, and contractors. This report provides an overview of the scrutiny we have applied to matters of concern and reflects the increasing attention we are giving to the impact of actions we have taken to strengthen the health and safety, welfare and scrutiny over the previous year. We've had a lot of alterations.
And sincere apologies, Michael, I did skip over your committee. I think the heat's got to me. So can we just go back to the Finance and Performance Committee and hand over to Michael Imperato, please?
Okay.
Right, okay. Yeah, so I take the report as being read. Last year was this committee's first year. It was a challenging year financially, but we succeeded in ending it just under the financial control target. There's a continuing challenge, of course, with finances. The other part of the committee's role is performance. It's a vast area, and again, a challenge for the committee. But I would like to say that we've made progress last year. There remains further work to do and to carry on doing. I'd like to thank the members of the committee and those who support the committee for all their assistance and contributions throughout the year. I'm happy to take any questions. Thank you.
Diolch, Michael. And now thanks to Ewan. Ewan's going to cover the Mental Health Legislation Committee as Chantal is unfortunately not able to join us today. Thank you, Ewan.
No problem at all. Happy to do so on behalf of Chantal. And again, echoing colleagues in terms of the thanks to all those involved in the committee itself, from officers to our practitioners. And also, I think we should note in terms of the committee as well, the Mental Health Sub-Legislation Committee as well, where we have a considerable number of external lay hospital managers who also give of their time as well. So I'd just like to thank them. We'll take the report as read, but as you can appreciate, mental health is a very sensitive area for our population, and the work which has been undertaken by the committee I think is just a snapshot in terms of the due care and consideration which is given to those individuals who are in our care through mental health, but also to those practitioners who continue to care for them in an appropriate way. Obviously, there is very specific legislation requirements in association with mental health, and you will see within the report, just to signpost colleagues to, if you so wish, that we did undertake a number of review of risks during the year, from risk to patient care at key locations, but also in terms of being unable to provide a community place of safety order to certain individuals as well, which were then discussed and I'm happy to say rectified as appropriate. But again, considerable amount of work with huge thanks to the sensitivities of those involved. So I'm happy to take any questions if necessary, but diolch yn fawr iawn.
Diolch, Hywel. What I was going to do is just take questions at the end so I can hand back to the chair at that point, if that's okay. So if we just go to Neil Pryor, our new chair of People Committee. Neil.
Diolch, thank you, Joe. So I'm the third chair actually of the People, Organisational and Development and Culture Committee in the last year. So thank you to Anna, who I've taken her place on the board. Thank you to Eleanor, who stepped in and chaired in the interim. And then, of course, as others have mentioned, thank you to Lisa, Joe, Claire and the team who support. So over the past year, the committee has had to deal with a number of issues, the scale and pace of change that the organisation has experienced. It's looked at workforce risk, particularly around recruitment and retention, and of course culture, which we're able to measure through things such as the staff survey, Speak Up, and equality, diversity and inclusion, which all contribute to the staff experience. And I think it's worth mentioning that staff do make the difference. So whilst we're a committee that meets 4 times a year, it absolutely will be focused and has been focused on making sure that we have an effective workplace in place, and we're doing everything we can to support staff, especially as we continue to go through some significant changes around recovery and the clinical services plan. So my commitment moving forward is that we will continue our focus on organisational culture, prioritising people, make sure we give strategic assurance to the board, use and embed evidence, especially around EDI, and think around the future workforce requirements of the health board. And with that, I'm happy to commend the report to the committee, to the board. Thank you.
Well, Neil, I'm just going to move on now to our Quality, Safety and Experience Committee, and our Vice Chair and Chair of the Committee is unfortunately not able to be with us today. So Rodri, the Vice Chair of the Committee, will now present the report.
I think Rodri's on mute, but I think you might have an issue and picked him where you can't hear Rodri. But
Apologies.
Rodri, you're on mute.
Hopefully you can hear me now. So the chair does apologise for not being here today. And just briefly, the Quality, Safety and Experience Committee continued to operate in an exceptionally challenging context, characterised by sustained operational pressures, fragile services and the ongoing requirements to strengthen governance as part of our recovery and improvement journey. Eleanor would like to thank everybody involved within that committee, and as you can see from the report, a lot of good work has been done to improve the quality and safety of patients' experience, but also us as a health board and the way we deliver our services. Therefore, with those few words, I'll pass back on to Joe.
Diolch, Rodri. And finally, I'm going to hand over to Winston Weir, our Chair of our Strategy and Planning Committee.
Thank you. I take the paper report as read. The purpose of the committee, Strategy and Planning, is to provide evidence-based timely advice to the board on strategies, strategic frameworks, business cases and service proposals, the alignment of enabling strategies including workforce, digital capital, estates and finance, looking at the health board's priorities and plans for improving population health, climate migration and adoption. The committee also provides assurance to the board in respect of its strategic aims, objectives, in particular the annual plan, effective partnership arrangements, improving population health and estates, so it covers quite a wide range. I'm delighted to chair this committee. It was established at the start of the year, and there is much going on. I'm grateful to my colleagues, both independent members and executive directors and committee support, in enabling us to discharge this responsibility. I just want to bring out a couple of highlights. So we welcomed the refresh of a healthier mid and wealth strategy, recognising that it retains the core direction of travel while more clearly articulating how care will be increasingly delivered through strengthened social model for care and well-being. We also, members, particularly encouraged by the improved alignment of population health 24/7 approach and a clearer integration with the emerging community by design strategic plan in first and early prevention. And finally, but not least, we also reviewed the clinical services plan, acknowledging the scale and complexity of the work undertaken following public consultation and conscientious consideration. I'm happy to take any questions on this committee. Thank you.
Winston, I'm going to hand back to the chair now in case there's any questions on any particular of the annual reports.
Thank you, Joe. Can you all hear me? Yeah, great. Okay, thank you, Joe. Thank you, colleagues, for your annual reports for the committees, clearly demonstrating there's been quite a lot of activity across each of our committees over the course of the 12 months, much of which have covered more than one committee remit. So it's great to see a positive and productive year within our committees and our programs of work. Before we move on, are there any questions or points for clarification anybody would seek? No? Okay, our next item is duty of candour annual report, and with the knowledge that Sharon can't join us today, I'm going to ask Cathy to present. Cathy.
Diolch o chi, Eithriadol ffawb. This report presents our duty of candour annual report to the Health Board for consideration and approval. The duty of candour is one of our key statutory duties within our quality and governance arrangements, and it provides the board with the assurance on how the organisation is meeting its responsibilities in relation to openness, transparency, learning and improvement. The report sets out the required summary of cases, themes, learning and improvement alongside the arrangements in place for ensuring oversight of compliance. The report's been considered through our Quality, Safety and Experience Committee, where it was presented for approval and discussion, and following the feedback and comments received at the committee, the report has been further updated and strengthened prior to being presented here today. I'd particularly like to acknowledge the support of the comms team, our communication team, in helping to ensure our report is clear, accessible and appropriate for our public-facing purpose. In the publication of papers, we have dropped an image off the front page, which will be added before we add it to our website once it's improved. I'd like to record thanks to Alwana Hughes-Mokes and her team for their helpful input, and to Caroline Bergin and colleagues for the work undertaken in preparing and refining the report. The board is asked to note the governance route through the Quality, Safety and Experience Committee, the updates made following the feedback, and to approve the report for publication. Diolch, Chair.
Thank you, Cathy. Colleagues, any questions or points for clarification? If not, then can I ask that we approve the duty of candour annual report? Well, great, okay. Fine. I'm going to move us now to year-end assurance and hand back to Joe.
Thank you, Chair. So we're now on the board effectiveness item, and for good governance and to comply with our standing orders, the board should produce a regular and vigorous self-assessment and evaluation of its operation and performance and that of its committees also, which we've seen in the previous item. This year, the board considered the board effectiveness during 25-26 at the board seminar held on the 23rd of April 2026. The assessment was based on evidence from a wide range of external and internal assurance that's provided to the Health Board on how it's performed during the year, and this was then fully reviewed and debated in the Audit Committee on the 7th of May 2026. Of the 10 areas of assessments that we've looked at this year, which is based on a model that's been adapted for NHS Wales, there were 10 areas and criteria that we assessed ourselves as the board. 2 had changed from the previous year. So one area had gone up to a level 4 from a level 3, and that was in relation to systems and structures relating to quality and safety. And 1 had reduced from a level 4 to a level 3, which was in relation to risk management compliance. And that was due to we've been redeveloping and redesigning our board assurance framework within this year. So we're hopeful that that will return to level 4 next year. Just to add, the board has been fully engaged in this process at the board seminar, and each of those 10 areas was debated in full with the criteria and scores agreed upon. So just commending it to the board for assurance, Chair.
Okay, are we assured? I think there's been some good progress. We've seen some improvement. What I think is reassuring is quite balanced. I think we've been quite robust and disciplined in terms of our assessment and our agreement at the board development session. So it feels to me as if the level of assurance is grounded in the reality of what we're trying to do across the board. Great. Yes, please.
Can you hear me? Okay. Thank you, and I do think it's a fair reflection of our board effectiveness, and we have debated this in detail. I think it's pleasing to see our progress on the board assurance framework, which was the item which where we felt at the end of the year we hadn't satisfactorily progressed it to say that we were staying at the same level. So that was the item where we particularly reduced in our board effectiveness, but I'm pleased to say we are on track to rectify it this year.
Thank you, Phil. Can I move us to item 6, which is Head of Internal Audit Opinion and Annual Report 25-26. Jo.
Yes, Chair. Thank you, Chair. So I'm presenting the report on behalf of James John, our Head of Internal Audit. So as you can see, the Head of Internal Audit Opinion and Report for 25-26 provides the organisation, and particularly the board, with a review and an overall opinion of the organisation's framework on governance, risk management and control. So just as you will be able to see, the internal audit plan is based on a risk-based approach. So we target areas of concern within the health board. So we look at areas where we know we may have a challenge and that may impact on the rating that each of those internal audits receives. So the Head of Internal Audit is predominantly based upon the percentage of audits, the significance of various findings, and also based upon the auditor's view of the organisation's governance at that point in time. It is disappointing, Chair, to report to the board that this year the Health Board has received a limited Head of Internal Audit opinion, which last year we received reasonable. That's based on that we have 3 substantial reports, 10 reasonable, but unfortunately we've had 10 limited internal audits this year, particularly in the operational governance area. What the Audit Committee received supplementary to this was detailed information into why that opinion had been formed and as to why it is limited this year. So I'm going to hand over to Rodri as our Chair of Audit Committee to provide an independent view and just an overview of the conversations that we held at Audit Committee on Tuesday of this week, Chair.
Thank you, Jo. And as was just said now, it is disappointing that we've had a limited assurance. As was said, 10 limited, 10 reasonable and 3 substantial assurance. It is a risk-based approach we are taking, which I think is the best approach to take to ensure that we do improve in areas where we know there are concerns. That's all I can say is perhaps we had a heavy meeting this Tuesday, then a lot of reports came on the 11th hour, which we felt a bit frustrated, but I can rest assured that I've met, Jo myself has met the Head of Internal Audit, and there's a new standard operating procedure in place improve the way we are working, to ensure that we are working and as can be seen, we've got a clear work plan to move forward to. I haven't got much more to say, just yes, it is disappointing, but we learn from our findings, and this can only make us a stronger health board moving forward. And I'm really hoping that the next year will be fruitful, beneficial, and we'll have a much better opinion next year. Thank you.
Thank you, Rodri. Thank you, Joe. Also, thank you to Internal Audit for undertaking the assessment. I share your concerns. I am disappointed in the limited assurance for this past year, partly because I know lots of people are working really hard, both within committees and across the organisation, to ensure that we maintain and we deliver higher standards in relation to our audit work. It is deeply unfortunate when the worst element of that manifests at this particular time, and our assessment is seen to be limited. On the one hand, it is what it is, but the key issue for me is that it partly says that people are not taking seriously across many parts of the organisation the requirement to ensure that we deliver on our recommendations and we improve the quality of our services and processes. So I think the challenge for us as a board is to ensure that over the course of this year, that we address that. And I think at the end of the year, if we manage to improve our assessment, then it will be because people are taking a lot more responsibility around ensuring that audit recommendations and actions are delivered appropriately and within time. And that for us is essential. I think it undermines much of our authority if we cannot get this right. It's not really acceptable. But thank you very much, Rodri, for all your hard work, and Joe, your hard work, and for Internal Audit. I know that you've worked hard to get us to this position, and I'm very grateful for your efforts and your commitment to do it. Okay, I'd like to now move us on to the annual report and final accounts for 25-26, and I'm going to hand over to Phil.
Diolch, Cadeirydd. So I'm pleased to present the annual accounts, the annual report to the board for 25-26 year. First of all, a big thank you to the Director of Finance's team, particularly the Director of Governance's team, in supporting the preparation of this report, which is a huge undertaking. So a big thank you to both of you and the team. I think secondly, reading through the report, there are so many things to be proud of, so many things that our staff do where they've improved services for our population, or we've made progress that I think seeing that does make me very proud indeed. And a huge thank you to all the staff for the big efforts that they put in last year. So I think, having said that, we need to recognise we're still improving, and I would also recognise that the public don't always experience the care that in the way that they would want, and certainly there is still a significant amount of improvement for us to do. So a thank you to the public for their forbearance as we improve our services further. I also thirdly need to recognise that we did not meet our statutory duty to break even, and nor did we meet our statutory duty to produce a balanced plan over 3 years, an IMTP. So we did not meet those two important statutory duties, which of course we are seeking to work on as rapidly as possible over this year. But with that, I'd perhaps hand over to Hugh for the annual accounts.
Thank you. Diolch, Phil, diolch, Cadeirydd. Mae'n anrhydedd mowr cael dod unwaith eto gyda'r adroddiad blynyddol a'r cyfrifon i'r bwrdd. Chair, there are Essentially 4 elements which we will need to approve today. Firstly is the performance report, which I think Phil has introduced, the accountability report, the annual accounts themselves, and of course the letter of representation, which is a letter that we provide as a board, signed under your name, to Audit Wales as part of their audit process. We'll come back to that approval after the next item, which will be the report from our auditors. And I particularly wanted to thank a number of colleagues as part of bringing this to where we are today. Firstly, on the performance report, the hard work done by the performance team and Mandy Chesterman in particular for bringing that forward. And on the accounts themselves, the finance team, it's a collective effort, but I do want to call out Rhian Davis. It's Rhian's last week at work this week before retiring, and phenomenal effort that she's put into supporting me since I've been here, and I know long before me arriving. I also want to thank Fiona Hancock, who has pulled this together then into what I think is a really well presented document, which is a good read. So I am hopeful that members of the public who have the opportunity will engage with the document and understand more about what the Health Board has provided over the last year. I also want to thank members of the Audit Committee. So to provide assurance to the board, these reports have had 2 iterations now through the Audit Committee, and grateful to Prodri as Chair and Joe as Director of Governance for the work that they did in supporting us to get to this point, and the scrutiny put in by the Audit Committee. But of course, we're at the tail end here of a financial year when there has been an awful lot of scrutiny put in throughout the year, and grateful to the work of the Finance and Performance Committee in providing that assurance to us, and in particular Michael Imperato as chair of that. I'm very grateful to the support given by colleagues through dealing with what has been a really challenging financial year in the last year, and a challenging year for us in terms of dealing with our performance issues. So my executive colleagues and colleagues indeed across the organisation, be they paid or unpaid volunteers and employed by the organisation, and also employed by partner organisations. So gratitude to all of those. I'm pleased to bring these accounts to you, which demonstrate a true and fair view of our position throughout the year, and we'll hear more about that from our internal auditors. But we do need external auditors, sorry, but we do need to reference our statutory duties. So firstly, our revenue resource limit. This is the limit we have for day-to-day expenditure, and how we contain that within the limit provided by government, within the funding provided by government. We didn't achieve that measure. In fact, we overspent by 20 million and 89,000. However, that is just slightly below the target control total given to us by government. So government recognised we were going to overspend last year and gave us a target control total of 21 million, and we just came in within that. It does mean that our cumulative 3-year duty, which is what the formal duty measures, is an overspend of 112 million and 43,000 over that 3-year period. And we need to acknowledge and recognise that we did not achieve that target. The second one is our capital resource limit, and I'm pleased to say that we did achieve that target with a small underspend of 38,000 against that position. But because of our underlying financial challenge, we didn't achieve our target, our statutory target, to present a 3-year balanced integrated medium-term plan. And that is an ongoing challenge for the board that we will continue to engage with. We do have one more administrative duty then that we need to achieve, which is to pay our suppliers within 30 days of receipt of goods or invoices, depending on which is earliest. And pleased to say that we did achieve that target with 96.6% of our invoices paid within time. Chair, page 7 of the slide deck indicates some of the manual changes that were done on our annual accounts, and they're very small changes that were made through the period of the audit. And page 8 indicates the next steps that we'll need to go through. In particular, we will present these accounts. The Auditor General will sign them tomorrow, and then they'll be presented to the Senedd on 30th of June. Chair, I do want to also acknowledge and express my gratitude to colleagues in Audit Wales for their support. This is a double act very much, and we can't do our job without the assurance role that our auditors provide. I'm grateful for the developing maturity of that relationship, and indeed that we were able to get into this process this year without any surprises, with good engagement, with weekly dialogue and good progress made. With that, I do want to acknowledge, in the same way that Phil did, that each of the statistics we see within our annual report and within the finance report does have a person at the other end of them, be those someone who has received great care or someone who is still waiting for care. And we need to recognise and acknowledge and understand that, and indeed that would be something we will come back to in future board meetings as well. Chair, happy to hand over for questions.
Thank you. Thank you, Hugh. Before we seek approval from the board, I'm just going to hand over to Rodri.
Diolch yn fawr, Cadeirydd. A gallai hefyd ddiolch I Hugh a'r tîm, a hefyd Joe a'r tîm am yr holl waith caled ran yr adroddiad blynyddol. Can I also thank Hugh and his team, also Joe and the team and everybody else involved with preparing this annual report. I would like to thank also Audit Wales, particularly Mr David Williams and team. Can I thank you for your attendance here today as well. Also, I'd like to thank Internal Audit for their contributions during the year. Therefore, for assurance to the board, I'd like to confirm that all elements of the annual report and accounts, that is the performance report, the accountability report and the accounts, have been reviewed in detail by the Audit and Risk Committee in the draft format in early May 2026 and the final draft stage on Tuesday. I am content that all required changes requested by Audit Wales and Welsh Government have been made and a robust audit trail retained. I can confirm as Chair of ARAC that the committee approved the annual report and accounts and recommends these for onward ratification by the board. But before we do that, I'd like to hand over to Audit Wales to go through the ISA 260 before the board can approve them. Chair.
Good afternoon. Can you hear me okay?
Great. Yeah.
Good afternoon. David Williams, Audit Manager at Audit Wales. It's very good to be here this afternoon. I'm pleased to say there's nothing of significance in the ISA 260 report, which reflects the quality of the draft accounts this year and the support we've had from the Director of Finance and the wider finance team. And we've been pleased at how the audit has progressed this year. The report summarises the main findings from the audit of your 25-26 annual report and accounts, and the findings have been discussed. All outstanding audit work and review is complete. As we've heard, we intend to issue an unqualified true and fair audit opinion, but a qualified regularity opinion. There are no significant matters to report, no uncorrected misstatements, and no audit recommendations in this report. Our proposed audit report is set out in Appendix 3. The audit report explains that the regularity opinion for 25-26 is qualified because the Health Board did not meet its revenue resource allocation over a 3-year period. The Auditor General also intends to issue a substantive report which explains why our audit opinion in respect of the regularity of expenditure is qualified. This report will also refer to the fact that the Health Board did not meet its financial duty to have an approved 3-year integrated medium-term plan. Appendix 4 details the standard letter of representation, which we request is signed and provided to us following today's board meeting. Following board approval of the annual report and accounts, the Auditor General intends to certify the accounts tomorrow morning prior to onward submission to Welsh Government by the deadline date of the 30th of June.
Thank you, Thank you, David. That was very clear and straightforward. Colleagues, any questions or thoughts before we go to approval? In that case, can I ask whether we are content to approve the performance report for 25-26? Firstly? Yep, I can see nods on screen. That we approve the accountability report for 25-26. Right, okay, and that we approve the annual accounts for 25-26. Yep, and that we note Audit Wales ISA 260 and letter of representation. Great, okay. Thank you very much. I think that formally closes the meeting. So date and time of the next meeting will be 9:30 on the 30th of July, 2027. Thank you very much for joining the meeting today.